Good afternoon, everybody. I just received my first dose of the vaccine here at the Heinz Convention Center's mass vaccination site. Process was quick and easy, and I feel fine. I want to thank all the partners that are involved in making this site happen, including CIC Health and FEMA, for running this massive operation. I want to give a quick update on the latest COVID data before I talk a little more about my experience. Yesterday, the Department of Public Health reported 2 days worth of data and reported 2,912 new COVID cases. That was on 113,587 new molecular tests for those 2 days. And we've now done more than 19.2 million tests here in Massachusetts. 707 patients are in the hospital being treated for COVID, and 163 are in the ICU. I think it's important for everybody to know that cases among younger people, when I say younger in this particular case, I'm talking under the age of 50, make up a far greater share of total cases than they did previously. And cases among older adults, those over the age of 60, have declined pretty dramatically. Over 4 million doses of vaccine have been administered here in the Commonwealth, and today we'll hit the milestone of having over 1.5 million people who are fully vaccinated. We're making significant progress on vaccinating our residents, and we continue to lead the nation in administering doses among all 24 states with more than 5 million people. And we continue to be in the top 10 of all states for doses administered. 82% of residents 75 and older have received a first dose, which is significantly above the national average of 76%. And we're one of 13 states that have vaccinated over 80% of our 75-plus population. 24% of Black residents and 16% of Hispanic residents have received a first dose, and that's about double the national average for both of those populations. We obviously have more work to do, but we're making significant progress on vaccinating a larger and larger share of our population, which will help us get closer to returning to normal. On Monday, individuals 55 and older and those with one qualifying medical condition became eligible to book an appointment. We also updated the list of qualifying health conditions to align with a recent update from the CDC to add certain medical conditions such as type 1 diabetes and cystic fibrosis. That means that an additional 1 million people are now eligible to get vaccinated starting this week. Our goal is to make sure that every person in the Commonwealth who wants a vaccine can get one as quickly as possible. And that's why there's over 300 public vaccination sites across Massachusetts run by a variety of providers like pharmacies, mass vac sites, regional collaboratives, community health centers, physicians' offices, and the like. If you're looking for an appointment at a mass vaccination site, you can pre-register for an appointment at mass.gov/COVID vaccine. It's simple and only takes a couple of minutes to get done. Pretty soon, residents will have the ability to go and make adjustments to their previous pre-registration to account for medical conditions that were newly added to the eligibility list. The mass vaccination sites are highly efficient, and they're doing thousands of doses every single day. Here at the Heinz, thanks to the partnership with FEMA, they're receiving an additional 6,000 doses a day, which allows them to do 7,000 shots. Even if you pre-register, you can continue to look for appointments at other sites via the state's VaxFinder tool at mass.gov/COVID vaccine. As I said, I got my first dose today. I pre-registered, was notified last week that I was now eligible to make an appointment, and I did. And so far, I feel great. And I just want to say that this vaccine is a critical tool to help end the pandemic. It's also a critical tool to help people feel safe and to help them protect themselves, their families, their friends, their coworkers, their neighbors, and their community from the virus. The vaccine's safe. It's gone through the same clinical testing protocols as other vaccines have. There are now something like 500 and some odd million doses that have been administered since this process began last fall. And if you have questions about the safety of the vaccine or potential side effects, you should talk to your doctor. You may experience some side effects from the vaccine, but as the nurse downstairs told me, that's just a sign that the vaccine is taking. And you certainly won't get COVID from the shot. The COVID vaccines also protect you from the new variants, of which there are several now, not just here in Massachusetts, but around the country and around the world. And that's one of the reasons why we're working as fast as we can to get shots into the arms of everyone who wants to get vaccinated. We've built up a significant vaccine infrastructure that has the capacity to handle far more doses than what we actually get from the federal government on a weekly basis, and we look forward to seeing increasing supply coming from them as we head toward the end of April and the beginning of May. This week, the federal government has directly allocated 385,000 doses in Massachusetts to community health centers, the federal retail pharmacy program, and community vaccination centers. That's in addition to the almost 445,000 doses that have been allocated to the Commonwealth from the federal government. The state allocation includes 198,000 first and second doses of Pfizer, 138,000 doses, first and second doses of Moderna, and about 109,000 doses of the one-dose J&J. While we expect to see increased shipments of J&J in the weeks ahead, right now, this week's significant shipment should be thought of as sort of a one-time allocation. The Community Vaccination Center, which is the FEMA program that supports the Hines and some of the mobile vaccination clinics that run out of here, is receiving 42,000 doses directly from the federal government. And through direct federal allocations, the federal retail pharmacy program here in Massachusetts will receive 255,000 doses, and an additional 4,500 doses are being sent to the pharmacy program from the state allocation. Community health centers are receiving about 120,000 doses between the state allocation and direct allocation from the federal government. And for the rest of the state allocation, mass vaccination sites are receiving about 116,000 doses. Health systems and healthcare providers are receiving about 164,000 doses. Regional collaboratives and local boards of health are receiving about 118,000 doses. 10,000 doses are going to mobile clinics to support long-term care facilities, congregate care, affordable low-income senior housing, and the homebound vaccination program that we launched about 10 days ago. Between the federal allocation and the J&J shipment, we have seen an increase in total doses shipped to Massachusetts, and we continue to outperform almost every state in the nation on how quickly we can turn that around and put it in people's arms. In closing, over 2.5 million people have received at least a first dose here in Massachusetts, and there are clear signs that we're getting a little closer to returning to normal. Many businesses are starting to reopen. Vaccines are letting families see their friends and family that they haven't been able to see for months. And this week, many elementary schools across the Commonwealth that have been remote only returned to the classroom. 90% of all elementary schools are back completely in person as of this week. That's 930 elementary schools covering more than 300,000 students across Massachusetts. But we all need to hold on just a little bit longer till we get past this pandemic. More and more people are getting vaccinated, which is terrific news, but we all still need to keep our guard up until we can get this virus behind us once and for all. People need to keep doing what they've been doing for the better part of the past year. Wear a mask when you're out in public, socially distance, get tested if you've been around anybody who tests positive for COVID, and if you're sick, stay home. And try to keep your informal gatherings small. And if you can stay within the bubble of those you are closest to until you and they get vaccinated, that would be terrific. And when it is your turn, go get vaccinated.